Hello, my name is Derek Ems, and I'm a health economics and outcomes research specialist at UCB. So I specialize in all types of epilepsy research, but also heavily focus on some of the rare epilepsies associated with Fintepla. So Dravet syndrome is a rare, lifelong, treatment-resistant DEE, and it is characterized by high seizure burden along with multiple comorbidities and a decreased quality of life. Sure. So this was a retrospective claims-based analysis utilizing the Komodo Healthcare claims database. And what we wanted to see was the treatment persistence of a fenfluramine-based regimen for Dravet syndrome over a 12-month period. And then also, how does that compare to the treatment persistence of Valproate and Levetiracetam over that same time period? So for this particular study, we define persistence as the duration of continuous medication supply without a gap of more than 90 days. So to put that in other terms, if a patient started one of the drugs of interest and there was ever a gap of more than 90 days in medication supply, they were no longer considered persistent and then censored out of the persistency analysis. So this study was conducted from April of 2016 to June 2023. And within that time period, we identified 311 individuals with Dravet who had used fenfluramine, and then 417 individuals who had used Valproate, and 296 who used levetiracetam. Sure. So I would say that the main findings of this study were that the overall 12-month persistence for fenfluramine was 72%, and then 43% for Valproate and 44% for levetiracetam. We also looked at persistence from a 6-month time point, and it was 84% for fenfluramine, 57% for Valproate, and 53% for levetiracetam. So it did show that individuals with Dravet syndrome using a fenfluramine-based regimen demonstrated a stronger persistence over a 12-month period as compared to those with levetiracetam and or Valproate. And to my knowledge, this is the first analysis of its kind utilizing real-world evidence from an administrative claims database to analyze fenfluramine persistency. So we really did not know what we were going to see going into this analysis. Sure. So, I think the main thing is that, if a majority of patients are remaining persistent on fenfluramine in a real-world setting, it is truly providing a benefit to the patient, whether that be a reduction in seizures or other health outcomes. We know that strong persistence is typically associated with improved efficacy and tolerability for chronic medications. So it is suggesting that there are real-world benefits of fenfluramine use in this population. Sure. So, I think first off, in terms of, how this is significant for patients, for those with Dravet, there is now another medication out there that is different from other currently approved medications. And based on the persistency data, it appears to have a sustained benefit for these patients. It's another option in a somewhat limited treatment landscape for those with these types of rare epilepsies. And, given that this was a retrospective claims-based analysis, there are some limitations just with these types of studies. These databases are typically structured for administrative and billing purposes. So they often lack the additional clinical information about the diseases of interest or health outcomes, medication utilization. So we don't know the particular reasons for discontinuation as that's not captured in this data set. And there's also some patients that could have Dravet, but they may not be accurately coded in the data set. So we'd miss capturing those patients in this particular analysis. So, moving forward, we are planning to conduct a similar analysis for Lennox-Gastaut syndrome patients. as well as also digging into further what are those reasons for discontinuation, or what is occurring in those 28% of patients who are no longer taking Fintepla. And then also, looking at, does the utilization of fenfluramine or some of these newer products that are out there for Dravet syndrome, are they having any sort of impact on mortality for these patients? So those are really some of the things that we see a need to investigate further based on the findings of this study.